everyone. Thank you, Dawn, for joining us today and sharing your expert advice with us. And also thank you to everyone that has joined in from your busy schedules. We greatly appreciate it. My name is Heather Martz-Keller. I am a marketing associate here at DTC. And for those of you who may not be fully aware of what DTC is, we are an IT company, specifically a managed services provider that serves clients in multiple different sectors. And basically, we make IT work for you. So now we'll turn it over to my counterpart, Victoria.
Hi everyone, my name is Victoria Doda and I am a creative marketing director here at DTC, and I'm going to give you a little background about our webinar series and what we do. So we have a monthly webinar series and the theme for 2021 is creating connections. So all year long we host a webinar once a month, and we're here to be a resource to everyone, and we host them on various topics and just to get information out to our clients, partners, just anyone that wants to tune in. Just so everyone is aware, this webinar will be recorded and it will be available to you on our YouTube channel and on our website after the fact today. And you can go back on and look at any of the webinars that we previously hosted. So it's a really great resource for anyone that wants to go check those out. I would like to thank Dawn, CEO and General Counsel at Linked Healthcare, for joining us today. And she's got a lot of great content to share with us and we're really excited. So without further ado, I'm going to let Dawn introduce herself and get us started.
Thanks, Heather and Victoria. I really appreciate it. So I'm both a corporate and healthcare lawyer, as well as the CEO and General Counsel of Linked Healthcare. So that's a little bit unique in our industry. In my capacity as an attorney, I provide legal guidance and advice regarding mergers and acquisitions, structured buy-ins and buyouts, healthcare regulatory compliance, HR matters, real estate, IP, and more. But today, I'm here in my capacity as the CEO and General Counsel of Linked Healthcare. Linked Healthcare is a practice management and outsourcing company really focused on the healthcare industry. And while we specialize in all aspects of dental, we also have many medical and veterinary clients. Really, regardless of whether a practice is a startup or established, our mission is to meet our clients where they are and to help them achieve their personal, financial, and clinical goals while providing them best-in-class services and solutions and the business acumen necessary to compete in today's changing market, which is exactly what we're going to be talking about today. We really offer a flexible suite of services and practice management solutions to ensure that you can navigate this new normal successfully. And that includes services from HR, compliance, legal issues, practice management, training, even clinical training, marketing, and other services. And they're just customized solutions for our clients. So with that said, let's get into the slide deck for today. So we have many tough decisions ahead of us. For sure, there have been challenges this past year. As the pandemic took hold through the country, particularly in the early stages, patients sheltered at home and dentists really saw volumes plummet, but stability is returning as we set the new normal. Change is not new for the dental industry. For years, dentists have been facing growing administrative and operational challenges triggered by government regulation, declining reimbursement rates, increased operational costs, and increased competition for new patients. That has just been exacerbated by the pandemic and the negative impact on patient behavior, even more regulation, lackluster or non-existing marketing efforts, and a reduction now in the availability of quality team members that a lot of practices are experiencing. So just to come up a little bit, total healthcare spend in the US for 2019 was $38 trillion, and that was expected to increase 65% to $5.5 trillion by 2025. We were all on track at the beginning of 2020, and then the pandemic hit. US GDP overall for 2020 fell by 3.5% by the end of the year, meaning that 2020 was likely the first year in recorded history that overall healthcare spend appears to have dropped. And that is even despite the rebound at the end of the year that appears to be coming, gratefully enough, in 2021. Though highly correlated with performance of the economy, dentistry has traditionally been one of the most profitable industries in healthcare. The dental segment of healthcare spend for 2019 represented $139 billion, although that was projected by the ADA to fall 38% in 2020. Gratefully, that segment only declined by 6%. And that's despite the significant rebound that we saw for many practices and despite widespread disparity by region. But there's additional regulations are here and more appear to be coming. So employer health coverage is such a key mechanism for the delivery of healthcare in the United States. And it's also a key initiative for the current administration. The Biden administration plan actually has three cornerstones. One is access to quality healthcare. Two is access to affordable healthcare. And three is really focused on reducing the healthcare disparities. There really has been a robust advertising and marketing campaign to that end surrounding the Affordable Care Act's open enrollment. They've expanded in most states open enrollment through May or even in August. There's also been explosive growth in the Medicare Advantage plans, and this is expected to continue as baby boomers combined with increased popularity of managed care and the encouraged enrollment continue. Medicaid, which was about 75 million participants before the pandemic, has now reached 90 million. And many employers have turned to self-funded plans as a result of the cost of providing quality, affordable health care to their employees. Employers with self-funded plans, by the way, are looking for modern tools, enabling their employees to better utilize their plans and to drive employee engagement, which is potentially an opportunity for the dental industry that we are seeing some software and definitely some process solutions around. So in addition to what's going on with healthcare coverage, taking effect in April was also the Cures Act, which specified that clinical notes are among electronic information that must not be blocked and must be made available free of charge to your patients, with some specific exemptions. But a lot of practices now are scrambling in order to keep up and make sure that their notes are complete and scrubbed, and that there's no other information in there that they wouldn't necessarily want to release to patients, but patients have access to it all. There are new HIPAA regulations coordinating with ONC's interoperability provisions. As proposed, these are going to strengthen patient rights, among other things, and there's also incorporated new revised penalty structures for HIPAA violations. And then, of course, OSHA, you have to mention that. OSHA has announced increased enforcement efforts related to the COVID-19 compliance. Since one of the other initiatives of the current administration is cost transparency, there's really been a shift overall in healthcare away from fee-for-service to value-based care. That shift isn't new. That shift has been happening for years. It hasn't necessarily completely affected dentistry, although most of the practices these days are at least 85% PPO, but more change is likely on the horizon in order to comply with the different regs that are proposed. We'll see if they're actually effectuated. But there have been some unique opportunities during this too. It's not just all increased regulation. So government assistance programs gratefully have continued, definitely with federal government assistance programs, states, and sometimes local governments. And then with greater stability, attention now has moved to closer examination of business priorities centered around operational efficiencies, including efforts to streamline staffing and better utilize technology. New safety protocols have been added for safe reopenings, as well as ongoing operations, which we've all been seeing and incorporating in all of our practices. And we've really witnessed technology jump to match this need in some creative ways. Practices that have adapted quickly or never stopped working are returning or exceeding pre-COVID-19 revenues. And this is even despite the fact that for many practices, hygiene reappointment rates are still off and overall are showing about a 13% decline. But hopefully those will be recovering soon. And telehealth is here to stay. Never really thought telehealth would take as much hold in dental as it has, but COVID-19 provided a much needed catalyst for the widespread utilization of telehealth services. And now there are many technology options that are available today. CMS has finalized permanent expansion of telehealth under Medicare, and several insurers have expanded telehealth coverage. Those were originally scheduled to sunset, but there is some indication that they're going to be continuing. And we also expect to see additional relaxation of certain licensure rules. So I think telemedicine is here to stay. So all that said, how are you going to add value to your practice in the changing market and re-envision your practice moving forward? That's becoming an interesting question. So next slide. Has all my hard work, dedication, and passion really paid off? I think the question you need to ask yourself is, can you be objective in that regard? It requires you to be honest and really oftentimes take an outside third-party view of your practice. But it really requires you to soul search a little bit and make sure that you understand why you went into this, and are you really hitting those targets? Have you accomplished your personal, professional, and financial goals? This makes the assumption, by the way, that you have them written out. Most studies indicate that very few practitioners have goals, and if they do have goals, most of them have never written them down, or they've Googled them or inherited them from other practices, but very few have customized goals for their practice. Are my mission and vision consistently on display for my patients? Are we just talking the talk, or are we really living it? It is communicate. I mean, to be successful, it really needs to be communicated to all staff and patients. Are you living it every day in all aspects of what you do, from timeliness to dedicated systems to the leadership that you're providing? Do you have a team member that upsets the apple cart, or do you have some unresolved HR issues that are affecting your vision and mission and the implementation of it over time? Am I thriving or just surviving? You really need to focus on rebounding and making sure that you're getting that 15 to 20% growth. If you're not and you're stagnating or you still haven't recovered, that's definitely a time to reassess and see if there are other things that you can do in order to jumpstart your practice. We definitely have several thoughts in that regard. But yeah, it's just time to take an objective view of your practice. If you haven't seen growth, ask yourself, why not? All right, so on to the tips. So tip number 1, evaluate and identify. I love this quote by Walt Disney. You can dream, create, design, and build the most wonderful place in the world, but it requires people to make that dream a reality. Isn't that absolutely true? You can build the most awesome dental office. You can put in the best technology. You can, make it beautiful on the inside. But, it really takes people to make your vision and mission a reality. Just you have to talk about, what is working with your practice? What is not working? Have you done an analysis of your practice? Do you have the reports also that make it possible for you to do that analysis? What are the barriers of success for your practice, both internal and external? Again, do you have the right team members in place for those jobs? And have you established a practice culture? Practice culture is really a contract that sets the tone and addresses the emotional and behavioral expectations for all your team members. When you're in the office, you're always on stage. Leave your baggage at the door. You say you're going to do something and then do it. Do you discourage gossip? Do you fuel the fire? Is there somebody else there that does? How can they expect to attend meetings on time if you don't attend meetings on time? What is the practice culture that you want for your particular office? And is that defined in a document? And is that something that you live by and go through with your employees and reassess on a regular basis? All right, good leaders create a vision, articulate the vision, passionately own the vision, and relentlessly drive it to competition. Jack Welch did a good job with that one. Unfortunately, there's no magic formula or one right answer. Each dentist or group practice has their own unique interests, concerns, goals, and value. And there's that old joke of dentistry is a part-time job, just 12 hours a day, which is true. In order to do it right, you need to spend not just time drilling and filling, but you need to make sure that you're working on the business aspect of your practice. And that's not something that every business owner loves to do, but it's something necessary in order to achieve and to reach your goals. All right, so tip number 2, assess your vision, mission, and goals. Really kind of take a step back. Why did you go into dentistry in the first place? Is your practice what you thought it would be? What is your vision and mission? And then really kind of look back on why did you, not just why did you went to dentistry, but where are you in the life cycle of your practice? Are you a new dentist with student loans, building a career, and really kind of trying to develop your patient base? Are you an established dentist with a solid patient base that just needs to understand the value of your practice and your future options for sale or your growth potential? Are you an exiting dentist? Are you looking for a retirement strategy or to maximize the value of the practice that you've built? Each one of these will influence your practice in a very different way. And so this is another factor, just as, a professional would come in and evaluate the plan for your practice. Have you objectively assessed whether your practice is set up to achieve your goals? Again, that's assuming that you've written them down. And really, your goals need to be realistic. If you just pulled them off the internet, that might not be the same goals that are realistic for your practice. And so you just need to have an understanding of, has something been customized for me and my growth? Is it realistic? Can I hit it? For example, you wouldn't want to put a bonus program in for your staff and then have it be unattainable. That wouldn't be successful. It wouldn't be motivational. It actually might have the opposite effect. Do you have a business and strategic plan to get there? Now, if few practices have goals, fewer have business plans out there, but it's a really good exercise to go ahead and evaluate where you are in your life cycle, where you are in your business plan, where are your goals, and to really put together a game plan on how you're going to get there. And then you have to embody that change. You really need to look at yourself first and how you are leading by example. If you want your team to change, then you need to change, and that change really has to start with you. And so even if you were to bring in an expert, for example, you need to make sure that you and that expert are in lockstep so that they are looking to you to see that you want to make any of the changes in your practice. And you need to make sure that you're perceived as leading that practice. Oftentimes, the leader in the practice is not necessarily the business owner. It might be somebody at the front desk. And you just need to make sure that, we change some of those shifts if necessary, depending on what you want for your practice. All right, tip number 3, your plan for practice growth. There are some great reasons to grow. So if you want to impact patients around the world, if you want to impact your team and your employees, if you're not growing, some dentists out there feel like then they're dying. Some grow because of the challenge. Some grow because they have a vision on the way things should be. Whether it's, legacy or generational wealth that's spawning growth, or just frankly, the opportunity in front of you to refresh. Those are great reasons to grow. Bad reasons to grow is if you're doing it because of the money and you don't love what you do. If it's fear of consolidation, if it's fear of competition, if it's just because you want to get out of the chair, or if it's to save on supplies. We've seen all these reasons. Can you grow? Sure. They're not necessarily the best reasons to grow. And if those are your reasons, then you probably just need to look deeper into the plan and see if growth is really the proper strategy, or maybe it's an exit strategy. Do you need help seeing the big picture for your practice and its potential for growth? Are you capable of seeing the big picture and then drilling down to the processes necessary to implement it? And do you have the right team in place to help? A lot of people are big picture people, and some really are detail oriented. Some people can get from the very big picture down into the minutia. Most people need help for that. And so make sure that you are empowering your team or hiring appropriate experts in order to make sure that your dream is realized. There are internal ways to grow and external ways to grow. And really, you're looking for incremental results, right? Small changes can lead to big results, depending on what sort of growth is put together in your business plan. It's just all about consistently trying to get better, absolutely every day. Roadblocks. There are roadblocks to everything that we do. We just need to craft a proper plan for getting around them. There are internal roadblocks. And if you want to know what those are, I'd almost start with one-on-one meetings with your team. Ask them and then be prepared to listen. They see patients and they listen to other staff. And that is an excellent place just to start as far as interviewing your team. External, ask your patients what they think and what they think you can do better. So your patients oftentimes are a really good source of this information, and that's not something that necessarily needs to get out, but we can definitely have surveys or other things that we indicate with certain patients within a practice in order just to get a feel for what they perceive some of the roadblocks might be to you getting to the next level. Do you have a strategic marketing plan? I love this quote by Henry Ford. Stopping advertising to save money is like stopping your watch to save time. Companies which are marketing in a recession of all shapes, sizes, and sectors have to make the difficult decision of where, when, and why to cut costs. And certainly during the pandemic, it has been consistent with other recessions that we've had over time. And very often marketing is the first head on the block. The theory being that if there are no patients to market to, you don't need marketers. However, if you look back historically, companies which increased marketing in the recession are proven to do better than competitors in the long run. I would say that those practices that really continued their marketing or even grew their marketing really widened the divide between high performing practices and those that have been slower to rebound. Companies who continued to advertise and build brand awareness during the heat of the pandemic came out at least 20%, if not more, ahead of where they were pre-pandemic. And those that reduced their advertising and brand awareness ended up 7% below their pre-pandemic levels at least. And it will take them much longer to catch up. They're at least 6 months behind. If you think about it, it's pretty obvious. At a time where other companies are reducing their activity, those that increased it have more exposure out in the market, but there are other reasons too. So the pandemic really forced us into more of a social media and social media management sort of role. And practices that were successful had social media strategies and patient engagement schedules. And these really continued through the pandemic and even into today. And they continue to pivot as various regulation continues to hit. Print media and other traditional avenues weren't as successful and still aren't, but they aren't irrelevant. They still have space out there in the world. And at some point, we'll be back to community events and other things too, but not yet. Social media, by the way, is more than just Facebook and Instagram posts. It's a coordinated effort on a coordinated schedule with a coordinated message. We spend a lot of time on website design, making sure that practices have proper SEO, that we're using multiple social media platforms. We're doing things like retargeting. We're spending money on AdWords, and we're doing an awful lot of analytics. And so, it's not just, getting Facebook up and going. There's a lot more to social media and to social media management for those practices that have really been taking advantage and knocking it out of the park. And then it goes without saying that growth can also be through practice acquisition and de novo planning. There are a lot of practices that are out there for sale right now. And that is, an easier path for sure, as far as jumpstarting your growth. You have a patient base that's already existing. Oftentimes you already have a gelled team, and the barriers to entry aren't so great. But there's also de novo planning. So there are 5 new dental practices that open every day in the United States, which is about 1,800 per year. That stat is staggering. However, there are many more practices that turn over in a practice acquisition than de novos every year. And there are certainly risks and rewards to both strategies. We're always happy to banter them back and forth, but really it goes on your goals and what's most important to you, being open and successful immediately or imprinting your culture. So there are various trade-offs and considerations that we work with our clients on in order to choose the best strategy for them. And we can't escape without talking about funding. So whether you're in a self-fund or whether you're going to need bank financing or whether you're going to need private equity for the next stage of growth, really, is a very personal decision. And it's also where you are in the growth life cycle and how many practices you currently have. All right, using data to drive growth. Have you developed a roadmap, not just for changing yourself and your business, but for impacting change? We have to gather the data that is going to help you make decisions. And not every data set is efficient for helping you make good decisions. And not all practice management systems have helpful reports. And so there are plenty of add-ons in this regard too. So depending what practice management system you're on, oftentimes it's say, do I have the right package? Is there a bolt-on that I need to consider? Do I need to export the information to Excel if I'm really good at that in order to get the stats that I need? But it's really necessary that you create a set of benchmarks that matches what you're trying to do with your practice. We call them KPIs, key performance indicators, but regardless, often practices have certain KPIs that we're going to be setting in order to make sure things are measurable. So first, we're going to go after the low-hanging fruit, for new patients, for example, and not saying these should be your benchmarks, but, typical benchmarks. What does your new patient conversion look like? How does your first impression reflect your brand and your patient experience? Are new patients actually growing your practice? Half of the money we spend on advertising was wasted. The trouble is, I don't know which half. That's a quote by John Wanamaker. And that means that you're not properly measuring, you're not measuring the right thing, you're certainly not tracking. And so again, ask yourself some questions about advertising for new patients and to see if it's working. Hygiene. So we want a third of your revenue to be coming from hygiene. But if you look at hygiene, study the net revenue. Evaluate the patients per visit. What is the prophy percentage? Do you have a scaling and root planing soft tissue program? What are the number of patients diagnosed versus the number of treatment plans that are accepted? Look at the hygiene reappointment rates, the rate of perio, the hygiene production per visit, for fluoride, for perio, for sealants, whatever the marks might be for your particular practice. And then understand how those KPIs or measures affect your practice. Look at things like collections and production, new patients, profitability, case acceptance barriers, and patient loyalty. There are also established benchmarks with regard to overhead. So breaking it down by supplies and labs and people cost and marketing, doctor compensation, and hygiene revenue. Are you looking at the practice at a granular level so that we know what levers we have in order to make change? What might be a little off? Where are you excelling right now? It's important to celebrate the gains and celebrate the good parts of your practice, but then looking at it in its entirety to see how it can be overall part of your success in the future. Implementation and training are definitely key, but it's also important that the team takes ownership of their metrics and understands how ultimately it's going to affect their compensation and how it's going to affect the overall growth of the practice. We're always going to try for incremental and consistent improvement. If you alter a lever on your practice by 5%, what is that going to do to your bottom line? How difficult would it be for you to rise the number of visits for your practice by 5%? What if you focused on increasing your production by visit? What if you focused on increasing collections? All of these levers have a direct and a big impact, oftentimes, to the bottom line of practices. How many patients walk out of your practice without an appointment? And do you know when it's the right time to add a doctor? Maybe the doctor in your practice is struggling, but sometimes adding a new doctor to those practices might just reinvigorate that doctor so that all of a sudden now you're hitting the stats that you need to hit. So oftentimes it's just a matter of establishing accountability for you and your team. Relationships really drive everything. It's not the old income minus expenses equals profitability. Now it's really people plus processes equals profitability. So it's kind of flipping the equation. Make sure there's clear practice roles that are defined, and team leadership is absolutely key. Make sure that you're hiring open-minded individuals and create 30, 60, 90-day measures. There has to be a behavior shift in order to create new habits, and new habits aren't developed overnight. So most commonly when we walk into practices, we hear all the time, it was always done this way. We absolutely, try to help in order to shift that mindset. And again, it's not done overnight. It does take time. And it does take, focus, improvement, and then follow-up in all cases to make sure that change is being implemented. All right, slide 8, tip number 5. What does a consultant bring to the table? So we see practices all day, every day. Well, not all practices are the same. It's really helpful to have a wealth of understanding behind us, so that we can brainstorm solutions for your practice. We see practices, in all sectors. We see general dentistry. We see all specialists. We see small solo practitioners. We see small groups. We see large group practices. And then we see other practices in the healthcare sector. This is really helpful when we're talking about solutions across the board, whether they be IT solutions, whether they be processes and support solutions. It's really nice to sort of have that walking into a situation so that we can brainstorm with our clients to make sure that we create the right solution for their practice. It's not a cookie cutter approach at all. It's really customized, and it allows that practitioner to really achieve that next level of growth. Business experience. Many dentists really love practicing and really hate the business of dentistry. And just even saying the business of dentistry makes their skin crawl. That's where we can come in and help. Not only can we help, do training on the clinical side, but really the business side, we love that. And we have members of our team that are clinical as well as, finance and business oriented. And so, we can come in at every aspect of the practice, and other consulting firms can too, and help to figure out, exactly where we can make that practice grow and excel. Consulting teams often have really diverse skill sets and access to those skill sets and technology, so it's worth mentioning. You don't need someone that's always going to be saying yes to you. Your staff and your team might do that to you, but that's not what you need. Sometimes you just need really honest feedback and dialogue in order to improve and grow. And somebody needs to be able to deliver those tough messages, so in a very kind way, by the way, so that you can hear what needs to happen so that you can achieve all of those goals that you have for your practice. And it's always helpful when you have a proven track record and that, you've worked with other practices. Dentists can reach out to one another to see what worked for them. All right, tip number 6, ask questions. So if you're going to hire a consultant, make sure that you understand what you're looking for. There are plenty of practice management consultants out there that have a very cookie cutter approach. During the pandemic, I can't tell you how many webinars have been out there. And it's definitely a less expensive approach, but definitely a less effective approach than a customized solution. And one size does not fit all, and somebody's problems down the street might not be yours. And so I would just say, if you are looking to be the practice management consultant for your own practice, fine, look around and see what you can find and try to implement that for your practice. But again, be aware that you're looking at a cookie cutter approach as opposed to something that might not really be fit for your particular practice. And then really assess what you're passionate about. What are your non-negotiables for your practice? Is there somebody in your practice that's going to stay and going to be able to run something, even if it's not where they're best suited because of XYZ reason? Maybe there's an HR issue in your practice. What are you passionate about for your practice? How's that going to resonate? And how is that going to affect the change that you're going to try to implement into your practice? Are your systems based on your mission and vision or theirs? Consultants, we all come in with our own missions and visions, but we need to make sure that we implement what your mission and vision is for your practice. And so it's about listening to you and making sure that it's what you're looking for at the end of the day. So if you're interviewing a consultant, just ask some questions regarding that. How will you express that too? How are they going to spend time if you don't have a mission and vision and you need them to help with that? That's something that consultants are set up to do absolutely all the time. But how are they then going to train your team on your mission and vision? And how are you going to live as a practice, embodying that new culture and the vision and mission moving forward? How are they going to effectuate that for you? How do you define profitability? It's pretty easy to say it's just a financial measure. Maybe it's not. Maybe it's something else for your particular practice. So just make sure that you assess that before you hire someone. And then what role will team culture play in this process? Is the consultant going to use this as part of their foundation, or are they just going to come in on a limited basis to do a limited project for you? When you talk with them about how they're going to evaluate your practice, is that going to be in person or is that going to be remote? Different consulting firms do that in different ways. And how are they going to create a system of accountability and ownership when they implement different processes through your organization? You can ask, they often tie key performance indicators. How do they tie accountability to compensation models? These are just things that you want to ask, again, when you're engaging a practice management firm. You want to make sure that you have a practice plan, and you want to make sure you have an understanding of what the goals are. Now, keep in mind that might change, but it's always good to have a plan in the beginning anyway. And, are you locked into an annual contract, a 6-month contract, or is it something that's month to month? Just make sure from a legal standpoint that you're checking that before you sign on the dotted line and that you're checking references for the practice management company that you're engaging. When should you not engage a practice management consultant? So if you're expecting miracles, there are a lot of things that a practice management company can do. And there are some that we can't. And so we just have to put together realistic expectations, because then you're happy, we're happy, and the plans are followed. If your mindset is because we've always done it that way, or you're not ready to make changes, then you probably shouldn't hire a consultant right now. If you're willing to kind of explore, change, and to see if the change is something that you're willing to make, that's fine. But there are practices that are sort of, they've dug their heels in, they want to use a particular system, particular technology, even if they know it might not be best for the long term. For a short-term reason. For example, maybe it's an exiting dentist, they're comfortable with their practice management system, but they developed it themselves. That's not a long-term solution, but they're not really in a place where they're going to be making any changes. That's good to know. But there are other things that we can do to help their practice. Know where your non-negotiables are. When you believe it's only your team that needs to change. Sometimes it is. Sometimes it is only the team. But be aware that sometimes, the consultant needs to be able to have those tough conversations with you respectfully in private, not in front of the team. But you need to be open to, how do we overall improve this, and how am I going to be part of the solution? All right, slide 11. Jeff Platt said, spend time up front to invest in systems and processes to make long-term growth sustainable. Systems and processes are absolutely key, but without the right team and systems in place, you're not going to make much progress. So it's really important that you spend the time and make the investment. Are you going to go all the way and create a standard operating protocol manual? Maybe. We just have to see what's best for your particular practice. Okay, slide 12. Debate. So know when to reach out for help. So hiring a practice management consultant is not just a bottom line cost. It would definitely add cost to your bottom line. However, we really improve your bottom line. There's a positive return on investment there. We at Linked Healthcare, we believe in helping dentists think differently about dentistry and their businesses so that you can weather the changing times. We do this really by listening to you. We have a comprehensive range of high quality and cost effective services and customized solutions that otherwise involve numerous vendors and take you out of the chair. Our commitment to the integrity of the profession and passion for what we do ensure that you remain competitive and autonomous if that's what you'd like to do. And I think that sets us apart from other solutions. And we have the resources to help you develop the practice you've always wanted. And we are here and we are happy to help. We offer complimentary practice analysis. And please feel free to email me directly when you're ready to get started at dresh@linkedhealthcare.com, which I believe is on the presentation deck. And you could always reach out to DTC in that regard as well. But thank you for taking the time with me this morning to walk through some approaches to how we can help you to navigate all this change that's currently going on within the dental industry and healthcare in general. We look forward to your help.
Yes, Dawn, thank you so much for giving us all of that advice, and for all of our viewers that have tuned in during this webinar and that will be viewing it after the webinar, and just all of the advice that you've given us regarding how to add value to dental practices. It was very, very wonderful listening to you. We will now turn to all of our registrants. If you have any questions that you would like to put in the chat, the floor is now open.
So we'll give everyone a couple minutes to type out their questions they want, but I know on our end, we do have a couple questions. So Dawn, I think we'll go ahead and just ask one right now while we wait and see if anyone has any other questions. I know that we talked a lot, or you talked a lot about mission and vision, and I think that's a very big topic in our conversations at DTC now. And it's an interesting concept to think about and to discuss when you should change those missions and visions. And the timing of that and how that plays into your company and your business. So just in your opinion, like what would you say is an appropriate time to revisit that, to change it? Is it always appropriate, or is there some indication there that you shouldn't do it right now, or you should?
Yeah, absolutely. So if I separate them, the mission really is, it defines the company's business and its objectives and its approach to reaching them, right? The vision, it's what's going to be the future position of your practice, right? And so, I think the future vision of your practice, that can definitely change over time, as you decide that maybe I don't want to be a solo practitioner, maybe I want a growth model, maybe I want multiple locations. But the mission of your practice, as far as what your business is probably not going to change. But your approach to reaching those objectives absolutely can be evaluated on a more regular basis. And so, you should at least be looking at that annually, if not every other year, to make sure that you're keeping pace so that you can ultimately reach that vision for your practice.
Thank you. And then I think for just an overarching question for people who maybe aren't in the mindset of shifting gears and going more towards growth, what would your best advice be to someone who is trying to shift those gears and to be more open and accepting to change in their business models or their business plans?
I think oftentimes it starts with a conversation with an accountant. You're looking at your performance of your practice, and it's either static, it's flatlining, or it's decreasing, or maybe it's increasing, but not at the rate that you would want it to increase. Sometimes that spark or that initial light bulb goes off, frankly, in those accounting review meetings, which I think are wonderful because it really kind of is an objective outside view of what your company is doing. And so, sometimes you just need the spark, wherever that spark initiates itself. And then from there, it's knowing what you are capable of doing, kind of assessing where you are in the process and the skill set that you have internally, and knowing then, is it something that I need to get an outside party involved in to make sure that I can make those changes? Am I just looking to do something small, like adding aesthetics to my practice? That's definitely going to be an additional source of revenue, and that I can handle that myself. Or is it a more massive change that I'm going to be making to, overall, over your entire practice, that's going to affect all systems of your practice and the interplay? Some practices think of their practice as the front and the back, and I really feel like that's a misnomer. It's ultimately one team. And so if you have one aspect of your practice that's non-performing or not performing to the way that you would like, yeah, absolutely. We have to break everything down and look at the individual practices and their performance at a very granular level. But ultimately, it does affect the entire practice. And so really, that's another avenue of, maybe something happened to your practice, or, maybe you have a feeling that, oh, maybe AR isn't quite what it needs to be, or, treatment plan acceptance is off, or whatever it is. But that leads to a much bigger project because it's not just one thing in isolation. You kind of have to look across the entire practice and see how those systems kind of filter across the entire thing, because it is one practice at the end of the day. And again, feeding into the practice culture is everyone playing a part in the success of that practice. And so, and you're never sure where that spark is going to start, but really recognizing it is the first thing. And then generally, that leads to knowing that you need to make a change within your company or your business.
Definitely. As I'm listening to you answer that and explain it, just thinking of it, it's like that can be a very overwhelming thing for someone who doesn't want to, or not want to, but hasn't shifted their thought into, oh, we need to change. And then once you see it and that light bulb goes off, and then you're like, I have to change everything. So I guess that plays into another question of when hiring a consultant, where do you begin? Where does that first step go? I know you had said the last question, you talk to your accountant, but when you realize that, what's that process look like?
Yeah, so obviously you can call us, Linked Healthcare. We are out there, and there are other practice management consultants that are out there too. And so then I would go back to that interview slide of the questions to ask. and figure out, are you just looking for a small one-time project? You need an employee handbook, or you need to revise your HR. Fine. Discrete project. Let me look for the consultants that are best in those discrete projects. Or am I looking for something more? And then you really have to make sure that your consultant that you're hiring is aligned with what you're trying to do. Do you need something that's more cookie cutter, or do you need something that's more customized to the practice project that you're trying to undertake? And whichever you choose, ultimately, it's going to affect your bottom line. And most projects have a return on investment, other than projects like, putting in an employee handbook, for example. But find a consultant that's aligned with your views and your values.
Thank you. Definitely. You just gave us so much great advice and I learned so many things today. And I appreciate you taking the time out of your busy schedule to be with us and just put together this content for us and share it with all of our viewers. I don't think that we have any other questions coming in, and I think from our end, you've covered all of our questions. If there's any last minute remarks or things that you thought would be valuable to add, if you wanted to do that now.
Yeah, we just appreciate the opportunity. Again, our contact information is going to be available on your website following this call, right?
Yes. And
Okay.
everyone that is an attendant will get a thank you email with the link to view this webinar after the fact. And in the webinar, the presentation has all of our contact information.
Fantastic. And again, we offer a complimentary analysis. It doesn't cost you anything. And if you have questions, big or small, just feel free to reach out. I'm always just an email or a phone call away, and happy to help.
All right. Well, thank you, Dawn, for joining us for our 4th webinar of our 2021 webinar series. And thank you to everyone for tuning in. Like I said before, the webinar will be available, the recording will be available on our website and on our YouTube channel, and you'll get a link to it in your email. And be sure to follow us on Facebook, Instagram, LinkedIn, Twitter. We post about our webinars monthly, so you guys will be keeping up to date with what we're doing and be able to see what exciting topic we'll be covering next. But thank you all again, and I hope everyone has a great rest of your Wednesday.
Thank you.
Thank you, Dawn.